Hi Pregnant.sg readers, my name is Dr. Winslow and I'm a psychiatrist at the Winslow Clinic at Novena Medical Center. I'm here to talk to you a little bit about postpartum depression. Now, what is postpartum depression and who develops it? Well, the important thing that mothers or expecting mothers need to know is that postpartum depression is actually pretty common. A lot of people experience the blues just after delivering because there's huge hormonal changes and a certain level of stress, as you may understand. But more than just stress and the blues is what is called postpartum depression, which can happen in 5 to 20% of mothers. It starts within the first month after delivery and it develops on. So what happens is you start to feel more and more sadness or lethargic or depressed. There are changes in appetite, changes in ability to sleep, to be able to focus on things. If these symptoms do not go away after a short period of time, it is actually important to seek some form of help from a therapist, a counselor, or a doctor. And important because it can actually affect your bonding with your child, it can affect the way that you bring up your child, and in effect it also affects your own livelihood or ability to enjoy being a parent. How do people actually notice the symptoms of depression and how do they get help? Well, the simple one is usually the spouse or the family members notice, and if they say that you are not the same, or you're spending more time crying, or there are bouts of real intense sadness which don't go away, it may be time to seek help. Treatment is actually relatively simple because depression is so common and it is so easily treated nowadays. You do not have to worry because there are many modes of treatment. For the milder forms, there's psychological therapy like cognitive behavioral therapy, where we actually help you to adjust the way that you focus on your attitudes, the world around you, and the way that you think. And if medication is required, there are medicines that do not affect your breastfeeding. It's important to choose the medications that are compatible with continued breastfeeding or continued functioning in normal life. In addition to this, there are simple measures which a mother can take after pregnancy. For example, try not to get into too stressful events. Try to offload whatever can be to your spouse, and it's quite easy. Spouses can actually help breastfeed even in the middle of the night with express breast milk, as I have had experience doing, so the mother can get a good night's sleep. In addition to this, you need to take good care of your own health, your nutrition. Make sure that you don't get dehydrated. Omega-3 fatty acids, vitamins, and just a healthy diet overall goes a long way towards restoring your balance. As soon as you're able to, get up and move. Despite the fact that many people teach you that you have to do nothing for 1 month, people who actually move and energize themselves build back their serotonin, build back their endorphin levels, endokinins, a lot faster than those who are not moving. So that's it from me, Dr. Winslow. Thank you.